好，观众朋友们，大家好，今天是11月16号，星期一，3点10分比平时晚了几分钟。我们为大家现场带来 BC 省新冠疫情的最新通报。今天是周一，按照惯例会有两天的周期的汇报。好，我们现在开始。
And Wednesday, we'll be providing written briefings at 3 o'clock.
那么现在还是这个卫生厅长 Enrique 那么也是说到礼拜二、礼拜三都会给书面通知，礼拜四会给大家这个重新的他们亲临现场给大家做简报，礼拜五还是书面。好。今天礼拜一给大家会汇报2个周期，让我们看看新增的数字会有多少。
Thank you and good
我觉得不乐观。
For today's briefing, we're reporting on 3 periods.
From
Friday to Saturday, we
had
654 new cases diagnosed with COVID-19. From Saturday to Sunday, an additional 659 people were diagnosed, and between Sunday and today, 646 new cases.
3天
That adds up to 1,959 people who've been diagnosed with COVID-19 over this weekend, including 3 epidemiologically linked cases, bringing our total in British Columbia to 22,944 people with COVID-19. By health authority, the new cases over the last 3 days are 455 people in Vancouver Coastal Health, 1,361 people in the Fraser Health Region, 41 people on Vancouver Island, 87 people in Interior Health Region, 14 people in the Northern Health Region, and a case in a person who resides outside of Canada. We're now up to 6,279 active cases around the province in all health authorities, of whom 181 people are in hospital, 57 of whom are in critical care or ICU.
181个住院，57个重症监护。
9 new COVID-19
9例死亡，
bringing our total to 299.
299例了。
Majority of these people were older. People living in long-term care, or people with underlying illnesses in hospital.
或者是在医院里边。
We're always struck by the challenges and the tragedy of having to deal with deaths at this time when it's so challenging for all of us. And our condolences and our thoughts are with the family members and the caregivers and the communities of these people. We continue to have a large number of people under active public health monitoring, 10,928 people, and 16,087 people who have now recovered from COVID-19.
好，我都会给大家。
Over this past 3 days as well, we've had 11 new healthcare outbreaks.
过去的3天里边，11个爆发，11个长期护理院，以及都是在沿岸和飞沙卫生局下的。
They are at the
Alpha
Pavilion, the Jackman Manor,
那么他会一个一个报这个不一定我都复述了，因为很多我也不知道。
Holy Family Hospital,
他都一个一个报。
the Arbutus Care Center, the PICS Assisted Living Center, the
这个
Village
太厉害
Fire
了， 这
Station,
次
Hamlets at West
疫情太厉
Side,
害。
and Burnaby Hospital.
Burnaby 医院都有了。
4 outbreaks were declared over in the past weekend.
那么过去3天里边有4个长期护理院和一急性诊疗所被宣布结束疫情。
More than once in this pandemic.
有一个是第2次爆发，然后结束。
We now have 52 active outbreaks in our healthcare system,
现在已经有52个了。
assisted living, and 7 in acute care.
包括7个
Additionally,
急
there
性
have
性
been
诊
a
疗
number
所。
of exposure events in our community and 2 new declared community outbreaks, one at the Platinum Athletic Club and the other our second school outbreak at the Cambridge Elementary School
2个社区爆发，一个是在夜总会，一个是在学校爆发。
As the number of
一个学校
cases
是
and
在
outbreaks is showing,
飞沙衛
we
生
are
局
in
下面
the
的小学。
most challenging of
这个是在
times.
对我们来
We
讲是
have
最
come
困難的
through
時
a
候。
wave. We're now
我們
in
已
the
經
midst of our second.
我們已經是
And
在
it has
第2
become
波
even more
疫情當中
challenging.
我們會面臨更加多的
And the virus is
挑
not
戰
stopping.
因为病毒不会再停止传播。我们现在是要所有的措施都要落实到位，保证行之有效。我们也在积极的学习这个病毒。我们也希望全省的人民能够个人的努力帮助我们，帮助我们的公卫系统，帮助我们的学校，然后保卫我们所爱的人。每一个最基本的自己的行为动作都能够聚集成一啊，就是这个意思，聚沙成塔。如果你不舒服生病了，请待在家里，不要再去做社交行为了。所以大家也知道了，我们在特殊的一些地区这个飞沙和延安卫生局下都有一些特殊的卫生命令，因为大家清楚这个病毒现在在我们的社区里边。我们必须要有社交方面的聚集的命令和自我限制，希望我们大家能够保持社交距离，能够随时随地的能够做到的。我也呼吁好多次了。虽然我们没有全省颁布强制戴口罩的命令，但是我已经说了很多次了。那么在很多情况下，我们就要戴口罩。因为这个是很重要的，特别是对我们每一个个人。每一个人最重要的就是戴口罩、洗手、保持社交距离。那么现在这个情况下，对口罩是最重要的。这个除了所以一系列的工作都要做，洗手咳嗽遮嘴巴。所以他说现在在我们的很多长期护理院和养老院等等，都是在因为聚集，还有家里边都是人员交居，所以造成了这个大规模的爆发。我们已经看到了，在过去的几个案例里边，很多都是人员聚集在室内里边，导致病毒的传播。有可能大家可能就是在叫孩子们去，所以现在大家能够尽量避免的做其他的无谓的社交活动。那么现在呢，那么很多地方我们都知道了，比如说去孩子接学校接孩子还有这个去看比赛等等，都要知道风险的存在，都要保持社交距离，都要戴口罩。
This is not to say masks are not important.
那么我们没有强制戴口罩，不等于不戴口罩。口罩是不重要的。我们知道，在过去10个月里边，这个很重要的其他的措施都合一起，口罩和戴口罩是和其他措施是同等的重要。
When we are around people we don't know and are unable to
我们因为不能始终保持人和人之间的安全距离，特别是在室内的时候，尤其是在 mall 里边，大家在购物的时候，那么或者是在零售商这些地方特别容易传播，所以这些地方大家都营业商店都要求大家戴口罩，所以我们也是希望每一个零售商都要求顾客们戴口罩来安全的购物。
A requirement to follow fire codes or meet sanitation requirements. In addition to such things as making sure there's barriers where needed, having fewer people in spaces.
所以除了这个以外呢，还有是希望大家要这个人员的聚集不要有空间要大，人口密度不要大，这个人和人之间保持足够的距离。那么很多地方要很多有安全的措施计划落实，或很多的组织、很多的营业场所等等的这些公共地方，特别是要为这个顾客着想也要提供口罩。如果有些顾客不能戴口罩，那么希望他们能够提供网上购物以及在路边给他们提货的这个服务。所以这些营业场所与雇主这个商店都要有这些详细的计划。
All of us need to pay attention
所以我们
to
每一
this,
个人
whether
都
we
要
work
格外
in
的
these
注意
settings
安
or
全
whether we're customers
那么一定
or
要帮助
clients.
我们的顾客
In
为
addition
他
to
们着
using
想
our safety layers and avoiding socializing
除了
right
这
now,
些措施以外
I
大家也
strongly
避免
encourage people to
社交
limit
活动
your travel
我
as
希望
much
大
as
家
possible.
能够鼓励
And
大
that
家
is in
能够
all areas
限
of
制
the
自己的
province.
社交行为
We have asked that only essential travel be
我们也是
considered
要
to
求
and
大
from
家
the
除了
areas where we're seeing
最
most
基本的
transmission in
旅
the
行以外
communities.
就不要再
But I
出
call
差
upon
了不要
people
旅行了
across the province. We need
我们也
to
知
go
道
back
省里
to
边
how
大
we
家
were
走来走
thinking
去
earlier on
这个
in
也
this
可以把病毒
pandemic
带来带
when
去
the virus was in our
因为
community.
这个
We
病
know
毒
a
已经在
lot
我们
more
的社
now.
区里边
And
了
we know that
比
the
过去
virus
更加
comes
多
with us. And when we travel, we bring that risk with us.
所以我们如
And we
果在
take
旅行的
home
话
the
即使
risk
在
from where we've
省内
been.
的话我们也
So
会把
now
病毒
is
带来
not
带去的
the
风险
time to travel for
所以
recreational
现
or
在我们
non-essential
不是
purposes.
建议大家
Whether it's
到
from
处
the lower
旅行的
mainland
时
to the
候
island,
特
whether
别
it's
是在
between
低
the
陆平
interior
原
and the
或
north,
者是
or
内
whether
陆
it's
和
to
内
and
陆
from
或
other
者是
provinces in
这个
Canada.
内陆到这个
We
其他
need
地方
to
或者
stay
是
local,
我
stay
们希
in
望
our
大家
communities
都待
now
在本地
and take those measures
希望
which
大
will
家
help
也
us
是采取
bend
措
our
施落
curve
实措
back
施
down.
希望能够把这个疫情曲线拉下
This is a challenging time.
这个是真的是
Getting
太
through the
困难的
surge
时
in new
候
cases and through this pandemic
我们每天看到这么多的新增的数字所以这个要求我们往回走一走我们也要考虑什么是最重要的
to support each other
让我们相互支持
It's how we reduce our risks. We protect our families,
如
those
果
we
我
are
们减
closest
少
to,
了这
our
个
loved
风
ones
险
and
那
our
么我们
communities.
就会对我们所最亲爱的
People
人
in
带来
British
很少
Columbia
的
continue to
风
show
险
unwavering resilience and adaptability. And we know what to do.
我们其实大家都知道我们是该怎么做我们相互支持相互帮助我们一起共同度过这么困难的时候我们也是相互转告让我们保护我们的邻居社区学校医院养老院我们把所有的该防护的措施都做上去
About vaccines.
那么我们今天也听到了一个令人鼓舞的消息就是疫苗那么我们现在还有时间要等待希望大家往回走一走我们每一个人所采取的措施所采取的行动累积起来就是一个防火墙对病毒就有效的防护所以我们能做到相互克制相互容让也是相互的安心是做得到的谢谢大家今天说的是 Moderna 的这个治疗效率是 94.5% 这个已经很高很高了福奇医生美国的首席医官上个礼拜不是首席医官就是那个这个白宫的这个新冠疫情工作小组的一个医生他是美国流传病学的一个专家他说这个 90% 已经很高了上次辉瑞这次是 94% 然后呢这个 Moderna 的这个疫苗它的储存还要方便30天以内放在冰箱30天以上的只要零下20度存储那么这样的话大大减少了运输的困难所以这样的话比辉瑞制药还要好那么卫生厅长也是对过去9例死亡的亲人和家庭表示诚挚的哀悼有6个是在飞沙的他说对我们的所有的我们的社区都造成了冲击我们也要传递我们的这个让大家知道我们的爱心情和大家在一起你们不是孤独的现在已经299个人死了从这个新冠疫情以来
I wanted to note a couple of things and just to say with respect to public health
那么我们的公卫系统的工作人员都付出了额外的努力辛勤的工作
contact tracing the work in
那么
public
他
health
们在
being
积极
done
的做这个跟踪接触工作现在已经超过1万多个人被我们的公卫系统工作人员在跟踪接触国组中刚才博尼医生说了10928个在我们的公卫系统的工作人员的这个监视下自我隔离那么在过去的3天里边也是每天超过了12000例的测试那么每一个礼拜一呢我会给大家更新我们的 PPE 就是 protective 这个personal protective equipment 个人防护设备，那么包括这个保护服。面具、眼镜、口罩、手套、消毒液我就不啰嗦了，因为都是乏味的数字。那么3天的数字我再给大家重复一下，我接下来还会给大家重复。上周5到6 654， 6到日659。日到1 646， 3天累计1959。那么一共是累计到现在是22944个，其中新增的飞沙卫生局是1361，沿岸卫生局是455，岛上卫生局新增了41例，北部卫生局是新增了14例，内陆卫生局新增了87例，跟旅行相关的新增了1例。目前为止记录在案的现在活跃案子是6279，住院的181例，其中57例在重症监护。让我再自我安慰一下，这个上个礼拜是155个住院，44个重症监护，这次是181个住院，57个重症监护，很遗憾有9例死亡。
This is an all-in 100% effort in our healthcare system.
那么他也是说到了我们的公卫系统的也是100%的努力上个礼拜单一个礼拜做了7000多例手术。
Being immunized more than normal. All of the people I talked to about under public health surveillance, all the testing that's being done, all of the long-term care and assisted living homes that are currently on outbreak protocol. This is an enormous effort.
那么所有的这些长期护理院现在都是采取了爆发的这个行动应对措施。
A lot of the preparations that have been made,
所以很多的准备都已经就绪
are proving themselves to have been necessary.
所以也是证明了这些措施是必须是必须的，而且是缺一不可的。
One time in the pandemic at 7 p.m., but all the time. And how we do that, I think, is very simple. We all have to be involved in stopping the spread in those regions and in every region of BC. And of course, it's not just healthcare workers. It's teachers and administrators and people who work in the public school systems who I think have done an admirable and remarkable job in doing all of the work they normally do and in dealing with COVID-19 protocols in schools, all of the people who provide us services in our community that are necessary, the people that I meet at Save on Foods and everyone else, all of those people require all of us to be all in. Last week, Fraser Health put out an infographic and a flow chart that showed how COVID-19 spread when just one person brought the virus to a wedding. There was another about a fitness center, another about a workplace. And what it tells us, I think, is how all of these events are linked, that we have to have a massive response in our healthcare system. We all have to do what we can do, and there are things that we can do. And Dr. Henry just talked about the things that we can do to make things better, how we can work together by standing apart. Right now, each of us needs to close the gaps and seal the cracks that allow COVID-19 into our lives. And that conceals, infect others in turn, often the people we love most. Each of us must consider our actions. Each of us must think of our behavior. Each of us
说了，50个人是上限，不等于你必须50个人。你这个地方只能10个人，你也是举50个人，那不是等于在杀人家吗？所以这个真的是不负责任，因为前2个月的时候呢，有这个家庭聚会50个人禁令，那么有些人呢，他的确主办方就发出了50个邀请，结果来了60个人，你又不能赶人家走啊，这个情况后来保尼也意识到这个问题，就是这个意思。保尼始终说了50不等于50以下就是安全的，没有这种说法。50表示我们的公卫系统的人员能够在48小时之内，95%以上的联系工作能够完成，这个是我们省的 工作容量50个，不等于50个以下就是安全的。也就是说，如果我们的空中接触人员是现在规模的翻1倍，再翻1倍，那这个 Bonnie Henry 可能就说了，那个200个人、100个人的限制了，就是说99个人的聚会也行啊。所以不是说这个数字50个人以下就是安全的，不是这个意思。当然，我在这儿再啰嗦，我们华裔还是很自觉、很自律的啊。这个由于政治正确，我在话筒里边也不能多说其他主义，我只能说我们华裔是做得最好的。
Parmi l'ensemble des cas confirmés de COVID-19, 172 personnes sont actuellement hospitalisées, dont 57 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You will not be audible until your name is called. The first question this afternoon is from Marcella Bernardo, News 1130.
这位记者老师提的很尖锐的问题啊，他还可以。
I just wanted to see if you have given any thought yet to possibly starting the Christmas break sooner this year for schools, namely in the Fraser Health and Vancouver Coastal Health regions, but possibly across the province.
那么他说了，这个圣诞节的假期马上要来了啊，能不能考虑到飞沙局下的学校，这个考虑有没有新的措施？他说我们最新的数据，看着学校的最新的数字，还表明了我们的所有的措施还是行之有效的。所以我各个社区的这个对学校的保护还是比较好。学校里边的传播率还是很低。我也知道这个对孩子们来讲，家庭来讲都是很重要的。那么如果从这个所有的事情放在一起来看那么在过去接下来1个月里边我们希望把疫情给曲线给拉下来，所以我们要社区里边做事情。所以我们还会在这个教室上课还是继续下去的，因为我们还要看到其他的措施同时到位。我们整个省就是这样我们可以看到了这个数据表明了这个问题，因为伯尼医生始终说了，这个学校里面的传播的数据不多。
From a supervisor at a school in Surrey who says that she was told a student in grade 6 told her that she only had to isolate for 1 week after testing positive for COVID-19. And someone at Fraser
他说他今天是在一个树里教育局的一个 monitor supervisor 又是听别的孩子说，有一个孩子只自我隔离了1个礼拜就上课了这个是很好的，必须澄清。
And this particular child told the supervisor that she didn't need to wear a mask and she wasn't going to.
然后呢，就是说让他戴个口罩就可以去上课了。
It's hard to comment on
那么他说这个我不便于评论，因为都是听说。那么关于隔离有两件事情要明白。
People are no longer infectious to others.
那么如果
10 days after their symptoms start.
如果他们的症状开始10天之后，他们没有对人家有传染性10天以后就没有传染性了。
and they
那么有些人呢，他的这个症状很轻，那么而且是已经结束了，那么10天以后那么他对其他人没有传播性了。传染性了，所以这是一个第二个事情，我们也是看到自我隔离的是如果他被暴露过了那么需要14天的这个，因为这里边有潜伏期，所以要14天的隔离因为这个里边，因为你还没有可能出现症状，14天里边会出现症状那么如果你是跟一个病人接触过了， 那么第2天你就要隔离14天，因为这个14天里边任何时候都可能有发表症状。但是如果你的症状出来了，10天以后就没有症状了没有传播性了。这个新的我也给大家再重复一下。今天保尼医生给了一个科普，也就是说，一个人症状出来了之后10天以后，他对其他人没有传染性了。这个明白了。其实他们这些话要多讲，要多给媒体讲。现在太多的自媒体为了博流量，那个就是在人群里边造成恐慌，因为越恐慌，人家越愿意看，越愿意传播，他的自媒体的流量就越大。但是对社会、对民众没有起到好的作用。但是这个是我们的信息自由的国家这个我们不能禁止这个，不能禁止那个。
That are in place now and perhaps even bringing in more.
Yeah, so the difference between what we were thinking about in April and what we know now?
他说现在和4月份不一样了，因为现在4月份我们很多很保守。那么现在我们知道如何安全的让学校开，如何的隔离，能够让餐厅能够开来，或者中小商店都能开来比如说人群隔离戴口罩或者是有机玻璃隔离那么还有呢，让他们减少营业时间所有的措施落实起来能够使这个环境安全的包括这个理发美容院如果你们都遵守我们的行为规范的话那么人群的限制人员的限制戴口罩那么这样的话都会安全的所以我们这个是很多和4月份不一样的所以我们现在主要是考虑的是社交的聚集的问题我们现在已经知道了这么在人群聚集的情况下室内这个病毒是很容易传播的所以大家一定要戴口罩保持社交距离特别是在这个社交场所的安全设定环境设定下包括这个大家的这个工作场所包括了体育室内的台球都可以打或者是怎么样结果大家只要是遵守我们行为准则规范所以希望我们大家能够不要更多的去外面社交不要见更多的人只是我们家庭成员紧密团结聚集这个不要到这种夜总会这样的话呢不要就会把病毒带回来的风险所以这个是我们希望大家能够注意的是社交的层面主要现在还是社交层面传播
Do you have a follow-up, Bender?
Yes, and this is for my colleague. It's thought that the music teacher at Cambridge school in Surrey could be the source of transmission for some of the students. And just wondering, should specialty teachers be able to teach hundreds of kids across multiple cohorts?
I know it's a really trying situation, and we're sending all of our positive thoughts and wishes to the teacher in question. I don't know the details of who was exposed to whom. I know that the initial exposures were from a community exposure, and then there was transmission in the school environment. It's a very good point, and we are looking at all of the initiatives around some of the specialties teachers, particularly music and physical education, where we know there's multiple classes, and making sure that the appropriate safety precautions are put in place for those to happen safely. And this, of course, will make us rethink, relook, make sure that things are being done in the best way to protect people.
Richard Sussman, Global News.
I'd like to ask about what Marcella brought up at the beginning around the school year, and you said you're speaking to federal counterparts about this. What are the pros and cons in either bumping up the school break, as in sending kids home early, or extending it into January? Are there thoughts on the pros and cons of that? And
他说，请你对学校的现在的关还是开都有个这个好处和坏处，哪怕现在延长到1月份在做这些事情，好处和坏处是什么？你都分析一下。
It's the community, but it's also looking at the things that we're doing in our community. So there's
我知道关医生很不喜欢这位记者的每次提的这些比较难堪的问题。
considering what makes sense, what information do we know, what's the data that we have on what's happening both in communities and schools. So we know some of the downsides are that there are many essential workers in our community, and finding places for children to be safely during the day needs to be considered. We know that older children will naturally congregate in other settings. So how do we make sure that those aren't more risky than some of the things that we're seeing happening now? So there are many different considerations that go into this. We want to make sure that we can do it in a way that doesn't adversely affect those businesses that are running safely. But we also want to make sure that our healthcare workers are supported, that they're able to continue functioning. As you know, this is a run-up to where we tend to have more people in hospital for a variety of reasons, and we're now, of course, seeing a surge in COVID patients as well. So there's many considerations that we have from a medical perspective. I also know that this is the time of year we tend to see over Christmas and into New Year's when we tend to see influenza surge. We're hopeful that this year the measures we're taking might help prevent some of that, and that's important. We also know that people want to spend time together over holiday seasons, and that can spill over into outbreaks in community settings afterwards. So there are many different things we're considering, and we need to have an understand what the impacts are going to be. And I don't know all of them, so we're consulting with different groups, and we'll continue to do that. But if we are going to make this change, it will be a thoughtful change that will be done ahead of time in discussion with the different stakeholder groups.
所以他说我也会跟不同的人、不同的群体、来自不同的行业都进行各种交谈。
One of the things, Dr. Henry, we're hearing from businesses on the mask mandate is a concern that, yes, people are hearing your advice, but without requiring it, customers in many cases are being abusive or rude to store managers or people who are working in those settings. So would a mandate not alleviate some of that animosity that is felt in those settings?
So there is an order that requires businesses to have COVID safety plans. And a retail location, for example, should have plans that include mask wearing. And that means making them available to people, making it clear that people need to wear a mask when they're in those settings, making sure that staff know when they need to wear masks in their setting as well. And those are enforceable, as I talked about today, in the same way that every other part of what we do in business. And if we look at Quebec, for example, that is their model as well, and that the onus is on businesses to make sure that masks are available and that people understand the rules within their business. And what I'm saying is, as a community, we need to recognize that those are rules that keep workers safe.
所以这样戴口罩的话，也是让员工和职员都能够安全包括了这个餐厅、零售商等等希望大家都是遵守我们的卫生命令。
We have a number of things that we do of personal behaviors, like cleaning your hands. For me, that is the perspective that we're taking from a provincial level. It's not us, it's not me who can find somebody. That's not what's going to make a difference here. What's going to make a difference is that people know clearly the rules and the situations that they're going into. The other thing that is clear, and we look at this across the country, and so not all provinces have a provincial level mandate. In Quebec, the onus is on businesses, and they have a fine on businesses. I don't believe that that's appropriate. But what we need to think about is that the mask mandate is not in and of itself something that
那么所
has
以
made
这
a
个戴
difference
口
in
罩不
terms
是
of
强制的，
transmission.
我理解了，
Many of
因
the
为很
settings
多
that
的
we are
空
talking
旷的
about
地方
are
不需
settings
要
where people would not naturally wear a mask,
而
like
且
in
他说
your
很多地
home
方不一
or at
定
a party. So these are things
不
we
一
have
定
to
必须要戴
take
口
into
罩，所以
account.
为
We
什
also
么戴
know
口罩没
that
有
when
强
there's
制
a，
但是一定要让人
fine
知道戴口罩的重要性，特别是这个餐厅啊、零售店啊，还有工作场所啊，大家自觉的戴口罩，而且你要戴口罩，因为我们的卫生措施里边都要戴口罩。那么这是每个卫生场所每个场所制定的这个特殊的自己的卫生条例。我们说到沃尔玛，我们到 Costco， 人家就要求你戴口罩，但是这个命令、这个卫生措施是由公卫系统批准的，所以这个场所必须戴口罩。所以他说，在全省范围，不是所有的地方都要必须戴口罩，所以戴口罩就不能成为强制戴口罩作为一个命令啊。比如说你到 Vernon 去了，那边是很空旷的地方，那么不要戴口罩，mask wearing should be part
of that. And that each of us as individuals have to take all of those measures that we have now more than ever. It is important for us to continue to clean our hands.
所以现在他说现在一定要注意，就是注意卫生距离、勤洗手更重要的时候了。现在比任何时候都重要。不管是去上班回来还是外面回来，都要戴口罩。还有呢，就是要戴口罩。现在多了说戴口罩了，不是说你认为不安全的距离下才戴口罩。现在就室内戴口罩了。
Yeah, so one of the things that we have learned about this virus is that a fever, so a high temperature, is not something that we're seeing very commonly, particularly in children.
这位记者为什么说这个量体温仪不是重要呢？因为他说因为很多。
Having said that, obviously, feeling unwell, feeling feverish is one of the symptoms that is a very important thing in every day.
那个量体温说错了，是自我检查的一个重要部分。那么现在也是看到了，有病毒感染了，会有这个体温上升。那么但是呢，也有些呢是就算有病毒了，它没有症状。所以这个是很重要的。我们要确保我们如果你不舒服就待在家里，所以我们的这个自我检查的这个标准提高了啊！你只要有一点点不舒服，你不能待在不能去了。啊，他是说到了疫苗的分发情况。他笑了。
So this is, lots of good news again today.
他说今天看到了很多的好消息，但是我数据还没看到，但是很多好消息。
But yeah, it's very exciting to hear
今天很兴奋。
已
经有2个疫苗已经马上要面世了。可能是几周或者是可能1-2个月。我们也是跟联邦政府一起积极的联络能够去一个是辉瑞，一个是 Moderna 能够从联邦政府那边得到支持，从美国购买到加拿大，能够新年以后能够在全国部署疫苗。我们也会有行为指南。已经那么过去这一年我们也做了很多的准备。
As part of our national pandemic planning for many years about
因为我们全国都有一个应急计划对这个流行病的应急计划。
And that was released last week by the National Advisory Committee on Immunization.
那么上个礼拜呢，也是全国免疫系统学会呢也发了一个这个很强的支持计划它会有一个优先次序。我们本身也是在做这个工作，如何分发疫苗。
And we're working on all of those details.
我们都是在关注具体的细节。但是你也听到了很多困难呢。那么辉瑞的疫苗呢，要极度的冷的温度下去运输保持。那么因为这个还有就是如何的就混合其他的一起在打针的时候那么 Moderna 呢这个 疫苗呢好一点他们不需要，但是也需要这个冰箱，但是呢不要它是零下20度那么这好多了那么还有呢运输的方法还不一样，所以我们还有很多的这个细节，包括他们这个一系列的行为规范都要做那么还有呢就我们还不知道哪些供应商就是这个运输商他有这个执照来做这些事情，来分发运输疫苗太多的事情所以我们也是在积极的在整队，所以我会马上给你们答案这个不是马上就能够出来的所以不等于就是说疫苗来了你们就不洗手了怎么样这个疫苗呢先给老弱的，先给这个最需要疫苗的人先打，这个是优先次序的我也希望我们BC每个人以后都能打到。
Hi, yeah, I'd like to know a little bit more about
也谢谢网友，谢谢 Wendy 也谢谢大家都平安。我相信我们都平安的，因为只要认真听 Bonnie Henry 的，我相信他不会有太多的误导或者隐瞒。我们只要是他也是说了，这个现在的和4月份还是不一样我宁愿选择相信。所以也感谢大家每次都收看我们的现场直播。
And it takes a period of time. So if I'm walking by somebody, even on a trail, if I'm running past somebody,
那么他说在室外，比如说你在外面 trail 走路或者是碰到遇见那么短时间的都不会有很大的风险，即使对方有病毒不会有这些情况下不会轻易传到所以在室外的话不戴口罩没问题。我们必须关注就是在特殊的室内环境下因为这些病毒是特别是在室内，特别是你15分钟以上脸对脸，或者是一起在吃饭，或者是在理发，或者是大家一起去吃喝喝那么我们知道了，所以这个时候呢戴口罩很有效。所以我们还有其他的一些措施要联合一起来才能阻止病毒的传播。所以只要是在室外和别人一起走路或者迎面遇见都没问题，都安全的。他说这个你走路超过人家或者是跟人家面对面走过不会有危险，不会有危险。
A little more detail on Christmas bubbles and who we have over to our home.
那么这位女士问的是关于圣诞节能不能有详细的这个严厉的限制措施现在还是 Safe 6
You know, I don't know the answer to that yet.
我现在还不知道答案。
What we're telling people right now,
但是我可以正告大家，
what we're seeing right now,
我们现在看到的，
if you're in the Fraser Health,
如果我们现在在飞沙卫生局下，或者是在低陆平原，我们必须就是要遵守这个命令禁令，我们的这个社交圈不能大。
Our close household, and you know, we've put out some definition of household because it's different for different people. It's who our family is, and that may be people that we're related to, it may be people that we are close to. So if people living alone, they may have 1 or 2 other people that are in their pandemic bubble. And thinking back to what we were thinking about in April, for some families that may who have children who live with both parents, that may be 2 families. Right now, that is the focus. In the rest of the province, we're starting to see increased transmission in our community, and we're saying you need, and there's an order about this. You need to stick to your safe 6. So your household plus those 1 set of 6 people maximum that your family is going to need. But right now, we need to think about reducing all of our social gatherings. We don't, if it's not necessary to visit, don't do it right now. Give it a break. Let us get the numbers down. And it's most important in those areas where we're seeing a lot of community transmission, but this is spreading around our province, and we now know that the season makes it easier for this virus to spread. So all of us need to think about no gatherings, supporting our families and our friends in remote ways, in ways that are safe.
这样的话才能保证我们的朋友和家庭更加安全。
This afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can access at news.gov.bc.ca. For updated information about regional orders, visit gov.bc.ca /regional restrictions. And for information about the province's pandemic supports, visit gov.bc.ca /COVID-19. Last question is from Briar Stewart, CBC.
那么也是说，不能说他说打了疫苗了或者疫苗来了啊，我们不洗手啊，不保持社交距离啊，不行的。
When it comes to COVID-19 transmission in South Asian communities, and if rates are higher, are there any factors driving that?
Yeah, so we have
这个问的是南亚啊，也是印裔啊，他就说了南亚就是印度裔啊。那么他说主要菲沙下面的啊，他不会说的，我相信波尼医生是比较左派的。那么他说主要是人员聚集多的地方。
So yes, we have seen transmission in that community
是的，我们是看到了这些社区的病毒的传播，我们也意识到
South Asian community are essential workers
有些都是这些，我们也看到一些基础工作的人就是
healthcare workers. Many
因为我们的工位系统工作人员跟踪接触也发觉，有些是必须上班的人，他们也是感染了。
There has been transmission in every community.
所以现在不是说哪一个社区有，哪个社区没有？现在是每一个社区都有。
Where I live, what my family's background is. So it has been a challenge for many, and we know that. And we know that there are many heroes in our South Asian community who have been working day and night.
所以我们也看到了，我们也听到了很多英雄事迹啊！这什么这么疫情的严重情况下，日以继夜的上班，他们是说也是保证了保护了我们社区的安全，我们的家庭安全，包括我们华裔社区，还有其他的族裔社区啊，都做得很好。我们华裔被表扬了，的确，我们华裔做的真的是很好。
First, to repeat what Dr. Henry has said, that we've seen significant transmission, and you saw when the information by local health area was released on Thursday, the monthly information.
最后有一位网友提到的这个问题，说实话，应该不建议去。不建议去，即使是这个症状，其实也是流感或者感冒的症状。现在情况比较复杂。我个人自从听了博医生到现在的新闻简报以后，我也学到了不少。只要有这些症状，是不要去上班。那么孩子们呢，小学呢，他们都会有一张表格给家长的一个自我检视的一个表格，一个一个每天自己有热度啊，那么这个喉咙怎么样啊？这个身体舒服吗？呼吸急促吗？还有就是这个流鼻涕吗？但是呢，10月份的时候呢，孩子们把流鼻涕这一项去掉了，就孩子们流鼻涕可以去上学的，因为也有这个
we have to continue to make an effort there.
那么也是说到了，就是我们把政府的我们的所有的信息都用各种语言啊，特别是中文啊，也是包括Punjabi 啊等等，都会给大家通过社区的宗教的领袖以及他们有影响力的这个领导，我们都把希望我们这个信息传播到社区里边，深入人心。我也感谢他们所做的努力。特别是上个礼拜5的印度的光明节，那么他们很多人都是用安全的方式来度过这个节日。因为大家都看到，因为现在知道这个病毒全省到处都有，不是说这个有那没有。那么现在看到，单单岛上都有200个 active case。
In the United States and across the world,
那么大家可以看到了，美国还要多很多地方都复发很严重。
We have to, as public health, have to reach out and deliver that message, and we need communities to be leaders as well.
那么，所以他说，我们作为公卫系统的人，我是卫生部厅长包括你们的社区的有影响的人，也是把这个我们的忠告我们的卫生行为指南都是带给社区去，请大家都重视这个问题。
Yes, I do. Just quickly, you talk about significant transmission, so I'm just wondering if that means that the transmission rate, I guess, or the number of people being
infected
is disproportionately higher than you would expect based on the population level. And if you could just answer Minister Dix the question about what's being done to reach out to the communities in French, that would be great. Thanks.
And we don't, as we've mentioned, we don't actually have rates by ethnicity of disease.
他说我们没有对族裔所做的传播率的分析。
What we are seeing
但是我们可以看到很多家庭受到影响了，很多社区他们已经很多是多代的他说了 South Asia 南亚，也就是这些印度人了。他们传播很多，因为有些家庭都是3代4代的，那么家庭聚集成员很多。那么现在卫生厅长用法语。那么我刚才提到了有一位最Nan 的网友说了，也就是他问了鼻涕，那么我回答一下，因为我是每次都听的。这个10月初的时候呢，孩子们的自我 screening 的一个 items 里边去掉了这个流鼻涕，因为他也回答了记者，就说孩子们的流鼻涕这个症状呢，跟现在看来跟这个 COVID-19 不相关，所以呢，只要孩子们流鼻涕也可以去上课了这是孩子们。至于您提到的大人流鼻涕是要不要去上班，我不清楚，但我认为只要不舒服，他们始终说了，只要你不舒服，你就远离人群，这个是很重要的。
aussi le farsi et d'autres langues parce que je pense qu'il est essentiel.
申请 EI 的话，这个 EI 它不是的 ，EI 不是这个范畴吧？好像是因为还有其他的这个救助事项可以。那么 EI 它这个项目里边没有说喉咙痛了可以不去上班，但是好像这个可以去跟家庭医生去讨论这个问题。这个是我个人的见解。
pas seulement aux gens dans des langues différentes, mais aussi
EI 应该不算，应该你请病假跟 EI 没关系，好像是。但我不知道现在这个新的这个 CRP 吗？这个叫 RECP 还是什么？就是紧急的2000块钱结束之后。好像省里边还有一个新的这个援助，可能可以去往这方面去问一问。
On a une équipe un peu partout dans la province, mais surtout dans le registre de Fraser Health.
因为卫生厅长都说的是法语，那我再把过去3天的数据再报告给大家。上周5到上周6是654个新增，上周6到上周日是新增659，那么昨天到今天新增了是646个，一共3天的。等一下我把声音关一关3天新增了是1959例，那么累计呢就是22944例，其中沿岸卫生局新增3天是455例，飞沙卫生局3天新增1361例，岛上3天41例，内陆卫生局3天新增87例，北部卫生局3天新增14例。3天里边还有1例是旅行相关，也就是 BC 省境外获得的。那么现在为止已经有全省有6279个活跃案子记录在案了，其中181个住院，重症监护的在这个181个里边重症监护了57个。很遗憾，过去的3天里边死了9个，其中6个在飞沙，3个在沿岸。那么全省累计到现在死于新冠的是299个。目前为止呢，在我们的公卫系统的监督下，有10928个人在自我隔离。还有一个呢，就是16087例已经全部痊愈了。那么今天呢，从伯尼医生那边听到的一些卫生常识，我也再简单的复述一下。第一，如果一个人有症状出现了，而且是被判断为新冠的话，10天以后它不具有传染性了。所以这个也解释了川普为什么到处走来走去了。那么这是一个。第二个呢，哪怕你昨天跟一个 有阳性病的人接触过，它叫被暴露过 exposure 了。那今天你在卫生公卫系统人员通知下自我隔离14天。那为什么这个要14天？因为在这个14天里边，如果没有症状，也就14天也就过了，哪怕你有新冠。如果有症状，那么就是新冠的阳性，那么也就是本来就要隔离。所以这个被暴露的就是要隔离14天，那么有症状的10天以后可以去上班，因为这个症状很轻的啊。那么如果你是说很严重，那就不一样了，是另外一个回事了。好了，各位观众感谢大家的收看，大家在留言区里边的留言对我也是鼓励，谢谢你们。那么我们这个礼拜4欢迎大家再回来。好，也祝大家平安。我们星期4再